Well, as you know, cold weather hit Houston with a vengeance this week. You've probably done something to protect your pipes and your plants and your pets, but what about your skin? Board-certified dermatologist Dr. Ingraham joining me now to tell us how to protect our skin from the cold. And it's a serious issue. We were just talking off camera just yesterday. I'm thinking, what is going on with my cuticles? They were all dried out and cracked and starting to hurt a little bit. What's going on?
Well, people are washing their hands like they normally do, and then they're washing them even more because it's flu and cold season.
That's right.
And so it's actually kind of counterintuitive. We have this wonderful evolutionarily designed protective barrier, and that barrier is full of cholesterol and lipids and free fatty acids. And what happens is every time you wash with soap, when it removes the germs and it removes the dirt, it removes those lipids, and then our skin goes into panic mode, and it doesn't maintain its acidic lipid barrier, and it breaks down, and then we're more prone to germs getting in our skin.
But Dr. Ingraham, you're not talking about going around with dirty hands all day, are you? So what do we do?
So you look for soap-free cleansers. So my favorite soap-free cleansers, this is a product called CeraVe we were talking about. They make a soap-free foaming and non-foaming cleanser, so keep that by all your sinks in your shower. I tell my patients, don't throw away your soap. I know people still like to use soap, but use soap in your underarms. Use soap where you're actually dirty. Your skin is naturally self-cleaning. Also, you want to make sure the minute you get out of the shower, you pat yourself dry and apply a barrier protective cream. In the wintertime, a cream is better than lotion. So CeraVe makes a wonderful body cream. And then if you are prone to more eczema type conditions, so people...
Some serious stuff.
Serious stuff. People who tend to be dry in general or have health conditions that make them dry would benefit from a barrier cream. All of us would in the wintertime, but especially if you're eczema prone, you may need to see your dermatologist and get a prescription barrier cream. And this is Episerum. This is one of my favorites. This is actually fortified with those lipids in the correct amount, free fatty acids and cholesterol, that repair that acidic skin barrier, and it's time released. So you put it on at bedtime, and overnight it's going to repair your skin. And so people whose hands tend to get chapped, you see that hand washing dermatitis, and I see patients with this all day long. We were talking about this. The tops of their hands start getting red, their cuticles become ragged, they can even crack and bleed. You may need to see a dermatologist and get a prescription for a barrier cream like this.
An actual prescription for something like this.
These are actual prescription products.
And insurance covers this kind of thing?
Insurance on most plans will cover this. There's several different brands, but this is one of my favorite because it's lightweight. As you know, you can put it on throughout the day, keep it in your bag at work, put it on at bedtime, and it will really in time heal those cracks.
All right, what about for my kids? You know, they're constantly biting the nails, and they've got the little cracks. Especially, I've noticed now, because it's so dry out, their cuticles really do need some help. Is there anything I can do without a prescription to help them?
So Vaseline at bedtime, if you want to get some Vaseline or Aquaphor, and before they go to bed, just put that on their cuticles. Not only does it feel and taste yucky to bite, but it will occlude those areas and help them heal.
All right, Dr. Ingraham, thank you so much for coming in. Always a pleasure. We really appreciate all of your advice.
Thank you for having me.
Well,